Hello, coders. Welcome back to another 3030 session with AMCI. Let me know, coders, first of all, are you able to hear me? How do I sound? Let me know in the chat. Okay, great. So, good morning, good evening, good afternoon, all depending upon where you're joining us from. And as I said, welcome back to another 3030 session with AMCI. I am so excited to see you all again. This is the favorite part of my week. And today we are diving into another important topic which you may even encounter for the exam. Yes, I am talking about dialysis coding, and we will break it down step by step, clear up the confusion between the ESRD management and dialysis procedure, and of course, go through some fun real world scenarios together. So grab your CPT manual and your highlighter. Let's decode the dialysis coding AMCI way. And first of all, let me okay, give me a moment, coders. Let me start by reading out the copyright. CPT Copyright 2025, American Medical Association, all rights reserved. CPC is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FDR, Churn, AMCI, FAB7, AMCI, ICD-10, Flip Tap, and MCG are the trademark of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA, and AMCI do not own right to these credentials. Okay, the dialysis CPT code ranges from 90935 through 90999, and these codes are all found in the medicine chapter of your CPT manual. So keep in mind when you're looking them up, you can find all these codes in the medicine section. And this section covers everything dialysis related. It includes your hemodialysis code, the ESRD management codes, other dialysis procedures like peritoneal dialysis, hemofiltration, etc. Now let's talk dialysis. Dialysis is basically a life-saving treatment that steps in when the kidneys can't do their job. It helps to remove waste, extra salt, and water, and keeps your blood pressure in check, and also balances important chemicals like potassium and sodium. So patients usually need dialysis when the kidney no longer can function properly or filter properly, most often in cases of end stage renal disease, or known as ESRD, or severe acute kidney injury, otherwise known as AKI. So understanding these two types is super important because how the dialysis is performed affects the code we use. Now there are two types of dialysis. One is hemodialysis as well as peritoneal dialysis. And we will be discussing in detail about them in the upcoming slides. Okay, now let's talk about the chronic kidney disease or CKD. CKD is a long-term progressive loss of kidney function, and it happens slowly over the months or even years. Now, as kidney lose their filtering power, the body struggles to balance the electrolyte, remove the waste, and regulate the fluids. So if a CKD isn't managed carefully, it can progress to end-stage renal disease, at which patients often need dialysis or kidney transplant to survive. Now, chronic kidney disease progress in 5 stages based on the kidney function. So, GFR rate, the glomerular filtration rate, is mostly used to identify the stage of the CKD. Now, we have CKD stage 1 with kidney damage with normal or high GFR. Stage 2, mild decrease in kidney function, and patient may start to noticing subtle signs. And stage 3, where there is a moderate decrease or complication like high blood pressure or anemia can appear. And also stage 4, where there's a severe decrease in the kidney function, that in this stage preparation for dialysis or transplant begins. And also stage 5, where kidney failure or ESRD. This stage is when patient might require the dialysis and kidney transplant usually is performed. Okay, so these are the 5 stages of CKD. Now next up, let's talk about acute kidney injury or AKI. Now the AKI is a sudden loss of kidney function happening over the hours or days, and the kidney can't remove waste, balance the fluids, or control the electrolytes properly, and it gets serious very fast. So the most common causes include low blood flow to the kidney. It might be due to dehydration or even heart problems. Then we have direct kidney damage. This can be caused due to the infections or certain drugs or toxins. Also, it can be caused due to blockage of the urine flow, like kidney stones or enlarged prostate. Now, the good news is AKI is often reversible if treated quickly. And unlike CKD, which progresses slowly and it can be very serious as well. So now let's break down two main type of dialysis and how they work. So as I said, there is a hemodialysis process, and in hemodialysis, blood is drawn from the patient's vascular access. It passes through the dialyzer where it is filtered and then returns cleansed to the body, and usually done 3 times a week. And this can be performed in a dialysis center or even at home. Then we have a peritoneal dialysis. Okay, peritoneal dialysis, in which a sterile dialysis solution is introduced into the peritoneal cavity via catheter. And the waste products and extra fluids move from the blood into the solution through a peritoneal membrane, and the fluid is then drained and replaced with fresh solution. This can be also often done at home, giving a patient flexibility. All right, now let's break down the ESRD service coding. So first start with a monthly outpatient ESRD service. So these codes are ranging from 90951 through 90962. And these monthly outpatient ESRD codes are reported once per month for each specific ESRD care in an outpatient setting. And this covers physician or QHP activities such as establishing a dialysis cycle, outpatient evaluation and management of dialysis visit, a telephone call, and patient management throughout the month. And importantly, very importantly, coders, if a complete assessment occurs and service spans less than a month, these codes still be used based on the visit performed. Now, let me give you an example. If a patient receiving monthly ESRD services get admitted to the hospital in between and a complete assessment was performed, you would report a monthly outpatient ESRD service which ranges from 90951 through 90962 instead of a per day code. So the key word here is that a complete assessment must be performed. Okay, remember that always. Now let's talk about home dialysis services. And these codes ranges from 90963 through 90966, and they are reported once per month for a month or for a full month of service. And these are also distinguished by age specific ESRD care for home dialysis patient. And next, let's look at inpatient ESRD or non-ESRD or outpatient ESRD dialysis codes. And they are, okay, let me move on to the next one. Yes. So these codes are ranging from 90935 through 90937. And we also have the code 90935 through 90937 is for hemodialysis. And we have code 90945 through 90947, that is for peritoneal dialysis. And we will discuss about hemodialysis and peritoneal dialysis in the coming slides. So let's now move on to the next set of codes, that is for partial month or special circumstances. Code series ranges from 90967 through 90970, and these are reported per day if the patient received less than a full month of ESRD care. Okay, so these are per day codes, and each month is considered 30 days for reporting purpose. Okay, and when does these codes use? When are we using these codes? They can be used in situations like transient patient, partial month with one or more face-to-face visit but no complete assessment, patient hospitalized before a complete assessment, dialysis stopped due to recovery or death, or in case where there is the kidney transplant recipients. Okay, so again, here I will give you another example. If patient receiving a monthly ESRD service get admitted to the hospital before complete assessment is performed and in between the month. And in such cases, you would report these per day code instead of monthly code. Again, here also the keyword is that complete assessment is not performed. Okay, only in the cases where complete assessment is not performed, we will code for the per day CPT codes. Okay, Chorus, let me know. Is that clear? Okay, so let's move on. Let's move on to the next section. Now, let's break down the monthly outpatient ESRD codes. And the codes are based on the patient's age and number of face-to-face visit per month. So for infants or for the patients who is younger than 2 years, we can use the codes ranging from 90951 through 90953. And again, these codes are further divided based on number of face-to-face visit. Then we have code series from 90954 through 90956. These are for patients age 2 to 11, between 2 to 11. And again, they are divided based on number of face-to-face visit. Then we have a code series for patients age between 12 to 19. Then a code series for patients age 20 plus. So think of it like a grid, age versus the visit. So once you see that pattern, picking the right code becomes much easier. Okay, next, let's talk about home dialysis codes. So they are reported per full month. And like the outpatient codes, they are also age specific. And you can see the codes 90963, that is for patients age younger than 2 years. Okay, and we have code 90964. This is for patient age 2 to 11 years old. And next we have 90965, that is for patients whose age is 12 to 19. So all these codes includes the nutrition, growth development, and parent counseling. Now next up, let's cover a partial month, or special circumstance ESRD codes. And these codes are ones ranging from 90967 through 90970. And these codes are used when a patient receives less than full month of dialysis services, and they are reported per day. And like other ESRD codes, these codes are also age specific. The CPT code 90967 is for patients younger than 2 years. 90968 is for patients whose age is between 2 to 11 years. And 90969 is for patients whose age is 12 to 19 years. And 90970 is for patients whose age is 20 years and older. Again, when do we use them? As I previously said, in the situations such as transient patients, partial month with one or more face-to-face visit but no complete assessment, patient hospitalized before complete assessment, and dialysis stopped due to recovery or death, or during kidney transplant recipients or for kidney transplant recipients. Okay, so these are the situations or places when we use per day codes. Next, let's talk about hemodialysis. All right, these codes are used for inpatient end stage renal disease, non-ESRD procedure, or for outpatient non-ESRD dialysis service. Okay, and we have three codes here, right? We have three codes. 90935 is used for hemodialysis procedure with single evaluation by physician or other qualified healthcare professional. And this is used when the physician evaluates the patient once during the session. And next we have 90937. This is for hemodialysis procedure requiring repeated evaluation. So that is the main difference between these two codes. 90935 is for single evaluation and 90937 is for repeated evaluation. We also have 90940 that is used for hemodialysis access flow study used to determine blood flow in grafts or arteriovenous fistula by indicator method. So this is important for checking whether the access is working properly. And these codes also covers the evaluation management services related to the patient's renal disease on the day of dialysis. And for separately identifiable E&M service unrelated to the dialysis procedure, use modifier 25 with the E&M codes like outpatient visits, consultation, inpatient or observation care, discharge services, emergency services codes, critical care, nursing facility, and home or resident E&M codes. Okay. Next, we have miscellaneous dialysis procedure codes. And these procedures are for the dialysis services other than hemodialysis, like, for example, peritoneal dialysis, hemofiltration, or continuous renal replacement therapy. So, any dialysis procedures other than hemodialysis, you code over here. Okay, and here also we have two codes. 90945, this is for dialysis procedure other than hemodialysis with single evaluation by physician or other qualified healthcare professional. So again, this is used when physician evaluates the patient once during the procedure. And next is 90947, this is for dialysis procedure other than hemodialysis requiring repeated evaluation with or without substantial revision to the dialysis prescription. And here also you can use 25 modifier if a separately identifiable E&M service is performed on the same day. Okay, great. So next, finally, we are coming to the other dialysis procedures, and the ones that doesn't falls under standard hemodialysis or peritoneal dialysis code. So here we have code 90989. That is for a dialysis training patient, or if applicable, the helper, and any mode completed course. Next, we have 90993. This is for dialysis training patient and helper if applicable, any mode course not completed per training session. Okay, so 90993 is used when the course is not completed. And we have 90997 that is used for hemoperfusion, such as using activated charcoal or resin. And this is specialized therapy to remove the toxin from the blood beyond the standard dialysis. Finally, we have 90999 that is unlisted dialysis procedure. This is can be for inpatient or outpatient and use this when there is a dialysis related services that does not have a specific CPT code. All right, coders. Now it's time for us to review our FTRs. What are the FTRs for the dialysis procedure or dialysis coding? Number one, hemodialysis are coded under 90935 through 90940. For inpatient, these are used for inpatient end-stage renal disease and non-ESRD services or outpatient non-ESRD services. We have miscellaneous dialysis procedure, which is coded under 90945 through 90947, and use dialysis procedures. These are for dialysis procedure other than hemodialysis. We have ESRD, which is monthly codes that is ranging from 90951 to 90970. You also have to always specify the location. Look for the location. If it is an inpatient, outpatient, or home. Okay. And check for the age of the patient because most of the codes are again classified based on the age. Very important. Check whether complete assessment is performed or not. And use a modified 25 with E&M codes for separately identifiable services unrelated to the dialysis procedure or renal failure that cannot be rendered during the dialysis session. And we also have a per day codes, which is not listed in the FTR over here. Okay, coders. Now, are you ready to test your knowledge? I know you all are. Let's do it. And here we go. You have your first exercise. I'll read out the options first. Option A 90970, option B 90962, option C 90935, option D 90945. Mr. Matthews, a 64-year-old male with acute renal failure secondary to dehydration, was admitted for the management of elevated BUN and creatinine levels. The nephrology team ordered the hemodialysis. Pre-procedure labs were reviewed and deemed appropriate. Physician personally supervised and performed the hemodialysis procedure. The patient was evaluated prior to the dialysis, monitored throughout, and tolerated the procedure well with no need for reevaluation during the session. Post-procedure assessment showed stable vitals and improved renal function indicators. So, of the following answers, which best describe the dialysis services performed? And you got 2 to 2.5 minutes, coders. You can type your answers in the chat and all the best. Okay, coders. I can see some great answers in the chat. Outstanding. Outstanding work. Okay, so let's go ahead and let's solve this scenario. And yes, so this is what we have. In diagnosis inventory, we have a patient with acute renal failure secondary to dehydration. Also, we have a procedure. In procedure inventory, we have a patient with hemodialysis. And now let's start looking into the code options. You know what, coders? I think I can eliminate two codes on site. 90962, which is option B, and 90970, which is option A. You know why? Type in the chat. You know why I can eliminate that outside? Let me know in the chat, coders. Yes, these two codes are for end stage renal disease, right? These are for ESRD services. And are we coding for ESRD service? Yes, that is also correct. Are we coding for ESRD service? No, right? We are not coding for any ESRD service. We are coding for a patient with acute renal failure that is secondary to dehydration. So option A and option B both have to go. Now we are left with option C and option D. You all are going with option C. I see that in the chat. So what is option D coding for? Option D is coding for 90945. That is for a dialysis procedure other than hemodialysis. Yes, and as I said in the beginning, we have two codes, like one for hemodialysis and the other for any dialysis procedures other than hemodialysis. So we are specifically here coding for a dialysis service, and 90945 is for any procedure or a dialysis service other than hemodialysis. So that is incorrect. And yes, you all are absolutely correct. The correct answer is option C, 90935. Excellent job, coders. Now let's move on to the next scenario. Here we go, exercise number 2. Okay, I will read out the last portion of the question first. Of the following answers, which best describe the procedure? We have option A, option A 90966, option B 90962, option C 90945, option C 90970. Mr. Smith, Mr. Smith, a 45-year-old with acute renal failure, underwent a peritoneal dialysis at an outpatient dialysis center as renal replacement therapy. Pre-procedure labs were reviewed and found appropriate. Local anesthesia and conscious sedation were administered for comfort. Peritoneal dialysis catheter was accessed under sterile condition, and a dialysate exchange was performed with monitoring for complication. The patient vitals and fluid balance was stable throughout, and post-procedure care instructions were provided. And of the following, which best describe the procedure? And coders, again, you have 2.5 minutes to answer. Your time begins now. All the best. Okay, that is time. And I can see a couple of answers in the chat already. So I've seen people saying they have some issues with the screen. So please switch on to the other streaming which is happening over here, and the link is already in the chat. The one which we are watching might be for a mobile view or a horizontal view. Please switch on to the other one for the landscape view. Okay. Okay, good. So let's move on and let's solve this scenario. And here also we have a patient with acute renal failure and a peritoneal dialysis was performed. So the keyword is yes, peritoneal dialysis. That's a keyword, and also acute renal failure, because here also I think we can eliminate option 90966, option 90962, and 90970 straight away, because all of them are coding for end stage renal disease. Right? 90966 is also coding for a home dialysis. 90967 is for per day codes, and 90962 is for a monthly service code. But the common factor is that all of them are coding for ESRD, and we are not looking at any ESRD code here. Patient came with an acute renal failure and a peritoneal dialysis was performed. So the correct answer is going to be option C, 90945, and that is for dialysis procedures other than hemodialysis, which includes your peritoneal dialysis as well. It can be also coded for a hemofiltration or other continuous renal replacement therapy with single evaluation by physician or other qualified healthcare professional. So fantastic job on the second scenario as well. I got one more scenario. No, I got a couple more scenarios. Let's go. Let's go and do the next one. Here we go. Exercise number 3. Of the following answers, which best describe nephrologist ESRD outpatient management services provided for this patient. Your options are option A, 90935, option B, 90966, option C, 90961, option D, 90970 times 10. Mr. Adams, a 62-year-old patient with end-stage renal disease, began outpatient dialysis on the 10th of the month. Nephrologists performed a complete monthly assessment and conducted 2 face-to-face visits to review the lab values and dialysis adequacy. Later in the month, on the 28th, the patient was admitted to the hospital due to fluid overload. Of the following answers, which best describe the nephrologist ESRD related outpatient management services provided for this patient? Okay, okay, cool. Just let me know in the chat. Your time begins now. Okay, I was just going through the chat and wonderful answers, coders. I am impressed. So those who have selected option C, please let me know why have you selected option C. You can type in the chat. In meanwhile, I will walk you through the scenario. Okay, coders, let me know why you have selected option C. And here we have, yep, we have in diagnosis inventory, ESRD services, procedure inventory, or outpatient dialysis was started or initiated on the 10th of the month, and there was two face-to-face visit. Patient was admitted on the 20th to an hospital. Okay, so dialysis, outpatient dialysis happened from 10th to the 19th. And option A is coding. Okay, we are coding for an ESRD related outpatient management services. And option A is coding for 90935, which is for an hemodialysis procedure with single evaluation by a physician or other qualified healthcare professional. And if you remember, coders, the guidelines which I said in the beginning, these codes, the 90935 and 90937, these hemodialysis code are used for inpatient ESRD, non-ESRD, and for outpatient non-ESRD dialysis service. And they are not to be used for outpatient ESRD management. Okay? Yes. So that means option A is incorrect. Option A has to go. Okay, I can see the answers from you in the chat. Good. Okay, keep it going. And now let's look into the next code. Option 90966 is incorrect, which is option B, because that is coding for end stage renal disease related service for home dialysis patient. And again, this is not a home dialysis service happened here. This was an outpatient dialysis service. So option B is also wrong. Now we are left with option C and option D. And option C is coding for a monthly service, and option D is coding for a per day service. Okay. Yes. And if you remember, coders, I said that the guideline states in circumstances in which the patient has had a complete assessment visit during the month and the services are provided over a period of less than a month, you can use the monthly service code 90951 through 90962, right? Based on the number of the visits performed. So here, patient didn't had a complete monthly assessment. In between, he got admitted. But still, we have to ask a question, was there a complete assessment performed? And the answer to that question is yes. We had a complete monthly assessment. And as per the guideline, if a complete monthly assessment happened, even if the patient got admitted in between, we can use a monthly service code. And that makes option D incorrect and option C the correct answer. Yes. And option C is coding for end-stage renal disease related monthly service for patients 20 years of age and older. So age category is met with 2 to 3 face-to-face visit by the physician or other qualified professional per month. How are you all doing, coders? Was that an aha moment? Let me know in the chat. How are you all doing? Excellent. So great. So let us move on and let's see another scenario. A similar scenario but in a different way. Okay, here we go. You might find it similar, but there is a small change. Okay, of the following answers which best describe the nephrologist ESRD related outpatient management service provided for this patient. Options are option A 90935, 90966, option C 90961, option D 90970 times 10. Mr. Adams, a 62-year-old patient with end-stage renal disease, began outpatient dialysis on the 10th of month. The nephrologist conducted two face-to-face visits during that period to monitor dialysis adequacy and review the lab values. Before the comprehensive monthly assessment could be completed, Mr. Adam was admitted to the hospital on the 20th due to complication related to fluid overload. Of the following answers, which best describe nephrologist ESRD related outpatient management service? Okay, coders, I think you need only 2 minutes to solve this one. You can answer under 2 minutes. Okay, and your time begins now. Okay, now let me solve this scenario for you all, coders. Great try, good try, and this is also almost same to the last or the previous scenario, but only a small changes here. And here also patient is diagnosed with an ESRD. Outpatient dialysis services was performed, initiated on the 10th. There was two face-to-face visit, and patient was admitted on the 20th. Okay, so what are we coding for? We are coding for ESRD related outpatient management codes. And as in the previous scenario, you cannot code 90935 here because, as I said, this is for hemodialysis procedures and they cannot be coded with or coded for an outpatient ESRD services. So option A is wrong. Option B is also incorrect as that is coding for a home dialysis service. Option B is also wrong. Now we are left with option C and option D, similar to last scenario. But coders, here is the catch. As I said, you have to ask in such scenarios whether a complete assessment was performed or not. So if you read carefully in this scenario, you will see that before a comprehensive monthly assessment could be completed, Mr. Adam was admitted to the hospital, right? And again, let's have a look into the guidelines. the guideline states that you can use the code 90967 through 90970 to distinguish the age-specific for end-stage renal disease services for less than a full month's service per day, and there are criteria or circumstances, and there I have highlighted the circumstance in our scenario that says that patient was hospitalized before a complete assessment was furnished, right? So was there any complete assessment done? I can see the answers are changing. Yes, there was no complete assessment done in this scenario. And that makes option C incorrect. So we have to code for per day services. And the correct answer is going to be 90970 times 10. And we can calculate like this. So patient was admitted on the 10th till the 19th, right? The services continue till the 19th. So there are 10 days. So for each day, we have to code 90970. So that would be 90970 times 10. Excellent. I can see those beautiful explanations. So was that an aha moment? Okay, good. As if you learn something that is priceless. Okay, now let's move on to the next scenario. And here we have exercise number 5. Of the following answers, which best describe the nephrologist's monthly ESRD related management service for home dialysis patient? Options are option A 90945, option B 90966, option C 90962, option D 90970. Mr. Johnson, a 54-year-old patient with end-stage renal disease, performs home dialysis as his renal replacement therapy. Nephrologist provided monthly oversight of the patient or home dialysis, including reviewing home treatment logs, lab values, and adequacy measures. The physician also conducted a complete monthly assessment and made necessary adjustment to the dialysis prescription. Of the following answers, which best describe the nephrologist's monthly ESRD related management service for home dialysis patient? And okay, we are running out of time. I will give you 1 minute for this one. You can answer it within that time. You all are amazing. Okay, Codis, your time begins now. Yes, absolutely correct. I can see only one alphabet in the chat, and that is alphabet B. Excellent, Goddess. Yes, that is the correct answer. So we have patient with an ESRD, and it's a home dialysis service that was performed here. It was a monthly home dialysis service, right? So option A coding for 90945, that is for a dialysis procedure. Okay, no, I'm looking at 90970 first. Okay, that is coding for a dialysis per day service, right? The end stage renal disease related services, dialysis for less than a full month. And we are not looking at a per day service. It was a complete assessment was performed, and this is a monthly service codes which we are looking at. So option D is incorrect. Next option 90945, that is option A, is also incorrect. That's for a dialysis procedure other than hemodialysis service. So this is also incorrect. We are specifically looking for home dialysis codes. So option A is also wrong. Option C is coding for 90962. That is for end stage renal disease related monthly services for patients 20 years of age and older with with one face-to-face visit by physician or other qualified healthcare professional. Again, this is also incorrect because we have a specific code for home dialysis service, and that is option B, which is 90966, which is for end stage ESRD. Okay, end stage renal disease related service for home dialysis per full month for patients 20 years of age and older. Yes, so option B is the correct answer. You all are doing a fantastic job. So I'll quickly move on to our next session. That is a poll session. It's a hand poll. So I will move a little bit quicker and you can type your answers in the chat. And here we go. The first poll question. Okay, this would be a rapid fire session. Okay, so which CPT code range is used for hemodialysis procedure? Is it option A 90945 through 90947, option B 90935 through 90940, option C 90951 through 90970, and option D 90989 through 90999? Okay, Goddess, come on. Type your answers quickly in the chat. If you have your books open, you can quickly identify these codes. And this is a rapid fire session. Okay, I will give you 10 seconds, 10 to 15 seconds to type your answers in the chat. There you go. Answers are already coming. Outstanding, outstanding. Yes. The correct answer is option B 90935 through 90940. These are used for hemodialysis procedure. Okay, let's bring up the next question. Monthly ESRD codes includes which of the following service? Establishment of dialysis cycle, option B outpatient evaluation management of the dialysis visit, option C telephone call and patient management, or option D all of the above. Come on, coders, you got this. Okay, the correct answer is going to be option D, all of the above. And yes, you can see or refer the guidelines over here. ESRD related services by a physician or qualified healthcare professional for CPT codes ranging from 90. Okay, this is for monthly ESRD service, and that includes your establishment of a dialysis cycle, outpatient evaluation and management of dialysis visit, telephone calls, and the patient management during the dialysis provided during a full month. Okay, that is fine. That is fine. As I said, if you have learned something from you, that is always priceless. Okay, so let's move on to the next one. Codes 90945 through 90947 are used for option A monthly ESRD service, option B dialysis procedure other than hemodialysis, option C outpatient dialysis only, and option D pediatric dialysis cases only. What say you, coders? Yes, on fire is what I say. Correct answer is option B. That is for dialysis procedures other than hemodialysis. Wonderful job. Let's move on to the next one. For hemodialysis procedure codes 90935 90937, which of the following statement is true? They include all the evaluation and management services related to the renal disease on the day of dialysis. Only one evaluation management is ever included for 90937. Modified 25 is not allowed for unrelated E&M. They are reported monthly like 90945, 951 and 90962, which is true statement, which is a true among these four. You know what, Chorus? You all are amazing. You all are amazing. You are taking this rapid fire session to another level. And yes, the correct answer is option A. And there you go. There is your reference. Great answers. Next one. Which dialysis service are built using codes 90951 through 90962? Is it inpatient hemodialysis? Option B, miscellaneous dialysis procedure. Option C, monthly end stage renal dialysis services. Or option D, dialysis equipment setup. Home dialysis equipment setup. Okay, Codas, let me know. And you all are going with option C. And that's what I see in the chat. If you say option C, I do agree with you. I have full confidence on you all. And it is for monthly end stage renal disease. ESRD monthly services, yes, 90951 through 90962 are reported once per month. They are for monthly services. There you go. Chat is on fire. Okay, this is going to be the last poll question. Hang in there, coders. ESRD monthly codes 90951 through 90962 may be reported if a complete assessment is performed, even when the ESRD service provided is for less than a month. Is this statement true or false? Okay, Chorus, I see that my mic was closed. So, Miss Dolly, can you please place the link in the chat, the survey link in the chat? And okay, Chorus, if you enjoyed the video, smash the like button, subscribe, and share it with someone who needs to see them. So, thank you once again for joining with us today for the 3030 session. I hope you all enjoyed it and picked up few new insights about the dialysis coding. It was great having you all here. Your energy, participation make these sessions so much fun, and I absolutely love this 3030 session. So, see you next time with another exciting and interesting topic. Until then, keep learning, keep coding, and thank you, Miss Dolly, and my team over there who are there in the chat. Okay, I will place the link in the survey link in the chat. So coders, please do fill up the survey link. Okay, coders. So I have placed the survey link in the chat. Please do fill them and see you all next week.